Welcome to East Meets West, an integrative approach to men's health. My name is Michael Johnson. I am an acupuncturist and co-host here, and I've been practicing for 15 years with a lot of focus on a lot of different conditions, including men's health, which is what we're here to talk about. And I want to introduce Dr. May, our expert in men's health here. Dr. May, tell them about you.
Yeah, Dr. May here. I'm a naturopathic physician, board certified in endocrinology with, again, like Mike, 15 years of experience, clinical experience. And I mostly treat hormone conditions now. So a lot of low testosterone in men, also treat some women too, but my passion is men's health. So excited to kind of talk through cardiovascular disease today because it still is the number one killer in men. So this is a big part of men's health, especially as we get older.
Well, speaking of smoking, I've always been curious. I know a little bit about it, but why is smoking so bad for cardiovascular health? Because when you think smoking, you think it hurts your lungs. So why is it bad for your heart?
Yeah, it all comes down to oxidative stress. So oxidative stress is kind of the same process that happens when metal rusts, right? It oxidizes. That same process happens inside your body. It's what causes your body to age and those cells to age and be destroyed, as we live. So we want to limit as much of that oxidative stress as we can. And this is where antioxidants come into, if you've ever heard that term used, like vitamin C and vitamin A and some of those others that we call antioxidants. That's what they do. They help to kind of calm down or quelch that oxidative stress. And smoking is just one of the things that can increase oxidative stress the most per time. And that's why, smoking, inhaling that stuff, poor air quality. We practiced in Fairbanks, Alaska, some of the worst air quality, in the world at certain times in the wintertime, right? It's like, all of that's going to create a massive amount of oxidative stress on your system. And that stress is going to damage the inside of your blood vessels. It's called the endothelium. And that's where plaque formation occurs.
Interesting. And it's actually very similar to Chinese medicine, as usual. We say this every single week, but the lung and the heart are connected in a lot of ways, and also the heart and the kidney. And so if you're having something that's damaging your lung, it's eventually going to hurt your heart. If you're going to have something that's damaging your kidneys, it's going to eventually hurt your heart, and vice versa, because they're all connected in different ways. And I find that interesting because there really is a connection, with the smoking and heart stuff, but then also with kidney issues and vice versa. High blood pressure can damage your kidneys if it's very, very high for a long time.
Yep.
And people don't realize that. They end up with kidney failure and they never realized they had hypertension.
Yep. They call it the silent killer for a reason. Oftentimes people can go years to decades and have high blood pressure and not even know it. Sometimes you might get a mild headache, but people can have mild to moderate high, blood pressure without any symptoms. And so imagine just imagine like a house with just kind of old pipes, and it's like if you increase the pressure inside that closed system for a period of time, something at some point is going to fail, right? Something's going to give out. And so we often see that in smaller blood vessels, which are going to be like in your kidneys or your brain or your heart, and those fail. And when they do, that can be pretty significant. So again, it's all about prevention. And back to the smoking kind of point too. Just studies that have looked at smoking and risk of cardiovascular disease. It's a really consistent model that's been looked at, and we see at least a minimum of a 2x increased risk of cardiovascular disease with smoking. And
that's awful.
It's pretty bad. And let's see, for sudden cardiac death, specifically, it's a 3-fold increase in relative risk among smokers versus non-smokers. Wow. So that risk of having that fatal heart attack, first off, is 3 times higher. So again, it's significant.
And I've seen this firsthand. One of my best friend's dads died at 48 years old from a massive heart attack. He was just a teenager. no idea anything was wrong, smoker. And going to the courthouse, just dropped. That was it. Instant. And you would have never figured. So not to scare y'all who are listening, but get stuff checked. I mean, it doesn't hurt to check your blood pressure. It doesn't hurt to talk to Dr. May or someone and see, like, is there something I can work on now while I'm a little younger, while there's not issues, even if you don't have a problem, to make sure you don't get to this place.
Yeah. I mean, I kind of do want to scare you a little bit. Like, a little bit of fear could be pretty a healthy motivator, right? And that often does, like, fear and pain are really good motivators to get things done. And guys, we suck at getting things done like this when it comes to ourselves or taking care of our health. Like, we really suck for the most part. And I think we need a big kick in the butt here, because this is not getting any better. Like, stats are just worsening. And so it's like, what are we going to do to change the course of this? And especially, if you don't even think about it in yourself, think about if you have kids, especially boys. Like, I have 4 boys. You've got a couple boys. Like if you don't even think about yourself, think about changing their, scope in life. Like, what are you going to do habit-wise and information-wise to teach them so that when they get your age, they're not having to deal with the same issues that you're having to deal with? We think about that in terms of, like, finances and education and stuff like that, but we don't think of it so much about health, right? Like, what sort of, strategies and habits can we pass down to them so that they are healthier at our age than we are, right?
Yeah, and I'll tell a little story before we move on. So when I first saw Dr. May as a practitioner in Alaska, that was actually one of the first questions you asked me. You probably don't even remember, but you were looking at family history. My family history is terrible, horrible, horrid. Like, everything that can go wrong has gone wrong. Cancer, early strokes, heart disease, everything. And I was just like, yeah, I guess I'm just kind of screwed, It's like everybody dies young. And you're like, well, like, you were not only asking, like, well, do you not want to live longer? Like, yeah, I do. It's like, well, there's things we can do, but you're also asking, like, what kind of quality do you want as you age, like, as you live longer? And you focused a lot of time on those questions, which I think are really good, because so many times I was the typical guy. I was just like, well, if it happens, it happens. There's nothing I can do about it. Say la vie. And you focused a lot on just like, okay, how do we change this trajectory? You have this genetic component, but that doesn't necessarily mean it has to be turned on.
Yeah. Well, you're totally right. And that's where I think getting down to the crux of it is, what do you want? Like, as a guy, like, what do you want in life? Do you want to live it up, live it hard, live it fast, and die young? Okay. I mean, this is your life. Like, do with it what you want. But if you want to live a long, healthy life where you don't have a lot of disability, you don't waste the last 20 years of your life, being stuck in a wheelchair or a chair, and you're just disabled, or you're not able to do the things that you want to do. So those last, 2 decades are just miserable. Like, what do you want that to look like? And some of this is some delayed gratification, right? It's like, what kind of work can you do now to create that life later on? Same with, like, finances, right? Like, if you want to be well retired, like, you've got to work your butt off right now, and you've got to put in the work so that you can reap the benefits later on. Same happens with your health. I have a colleague who, his little catchphrase for the longest has been accumulate health. And early on I was like, that's kind of weird. I don't know about that. But, now that, like, I mean, he stuck with it too for years and years. I'm like, man, that's a great way to look at it. You do accumulate health, but in order to accumulate it, just like wealth, you have to be persistent and consistent with it, and just, understanding that sort of delayed gratification.
And habits, man. Like, I'm actually doing a class with a master class with the guy who wrote Atomic Habits. Great book. Atomic Habits is a great book, but it talks about changing your habits and how daunting it can be, and, like, make it easy, make it something achievable, and start small. So if you guys are at a place where it's like, yeah, I know I have higher blood pressure than I should, what should I do? It's like, start with small things. Start with things you can control, and also talk to a doctor you trust. If you don't trust an MD, then talk to a naturopath like Dr. May. Like, talk to a doctor you trust who can help you manage and track, because it's a lot easier to track with help than without.
Right. Yeah. Yeah. Well said, man. All right. Anything else from a Chinese perspective as far as like assessment goes?
Yeah. So unfortunately, a lot of the assessment in the old days was just like, you have this crushing chest pain and it feels congested. What do I do? But there are some lead ups to that. So a lot of times you're going to check liver stuff, which when we talk liver, a lot of times we're talking about stress and anxiety and everyday things, and your sympathetic nervous system's through the roof. And so that's one of the precursors with Chinese medicine. Like, you want to keep the liver down or it can damage the heart, which makes sense when you look at stress, anxiety, sympathetic nervous system activation. So, before it gets to those points, you really want to keep an eye on that. And also diet is a huge thing. Good diet, exercise. If you're overweight, exercising and getting your diet right is going to be a big component. Part of Chinese medicine, they actually call it phlegm and dampness in the heart, which I find very interesting if you think about blockages in the arteries, because 2,000 years ago, they were saying it's this damp phlegm that's stuck, that's basically making it where blood can't flow. And if you look at cholesterol and artery clogs, right, it's like this dampness where things can't flow. So I find it really interesting.
Oh, that is really cool. And too, like, just to clarify, you were talking about sympathetic nervous system activation. So just a little bit about, if you're not familiar with those terms. So part of your autonomic nervous system, which is the part of your nervous system that's always just automatic, right? It's just working in the background. You don't have to think about it. You have to be intentional about directing it. It's made up of two parts. It's your sympathetic and your parasympathetic. So the kind of easy way we can remember those two is sympathetic is your fight or flight. So it's that stress part of it. And parasympathetic is like rest and digest. So it's like the really calm down kind of version of it. And then we want a nice balance between those two, and we want to activate those when we need to. So most of the time we should be in a parasympathetic state. But, in periods where we're stressed out, we need to run from the bear kind of situation, we need to jump into sympathetics, really quickly and easily. And then once that trigger is gone, we're back to parasympathetics. So what the problem today is, we spend a lot of time in sympathetic mode. And what that does to your cardiovascular system is it increases pressure. Because think about, if you need to run from the bear, you need your blood pressure to go up, your heart rate to go up. You need to pump blood out quickly to your muscles so that you can run, right? And so there's an increase in pressure for a specific reason. And that's fine for that period of time. But if you think, like, if you're in that state all the time, you're just stressed out, and your body feels like it's running from the bear day in, day night, and night, then obviously that's bad. That's too much pressure in your system for too long. And just like that sort of pipe in the house analogy I used earlier, something's going to burst. Something's going to break eventually. And so that's kind of just to clarify the sympathetic stuff.
No, thank you. Sometimes I forget. And something else, that's common sense is, like, if you're wondering, like, is there really anything to this, like high stress, sympathetic stuff? Think about every healthy person you've ever met in their 80s or 90s, and think about if they're a giant stress ball who's chain smoking and worries about every little thing and is just miserable. Most likely, if they're healthy in their 80s, you haven't met those people. They're usually like, they take life as it comes. They work out, they eat well, and they're not super high stress.
Yeah, that's a great point. I was curious about this, so I kind of did some digging on some numbers on stress and cardiovascular disease in men. Let me just throw out a few things here. So men who experience either job strain or what's called an effort reward imbalance. So we know we have to work hard, but if that reward that we get from that job is less then the effort that we're putting into it, that becomes a stress on our system. And what the study showed was this imbalance created a 49% increased risk of heart disease compared to those without those stressors. So that increases 50%. Okay. A separate study found that depression and anxiety, which also obviously can be related to stress, increase the risk of major cardiovascular diseases or events like heart attacks or stroke by 35%. Ooh. And the kicker here, so get this, guys, listen up, because I'm definitely guilty of this. We tend to have kind of more short fuses, and we build things up until eventually they burst, and we get this angry outburst. And listen to this. This study showed that in the 2 hours following an angry outburst, the risk of heart attack is nearly 5 times greater, and the risk of stroke is 3 times greater.
Yep.
Yeah. Just think about that for a second. Okay. It's like, and that's usually because we're not very good at stress management and doing things to try to alleviate stress. So we let it build until at some point it's going to burst. And at that point, your risk of heart attack and stroke goes up significantly.
Yep. And I've actually seen this in practice. I've seen people, when I ask what came before their heart attack or stroke, it's like, I got really mad and I was like screaming angry, and then it happened. I mean, I've seen this before. It absolutely happens.
Yeah. Yeah, absolutely.